Hello, everyone, and I hope that you and your families are staying well and safe during this COVID-19 pandemic. I want to spend a little bit of time today talking about cognitive behavioral strategies that may help manage anxiety and give you some tools to build resiliency in the current COVID-19 pandemic crisis. As all of us are experiencing this pandemic and the healthcare system is shouldering the largest burden, many are concerned that the crisis will overwhelm our healthcare system. Thus, it is not surprising that many healthcare providers feel overwhelmed and anxious. The biological basis for anxiety is based on activation of the limbic system, as many of us are aware, when we are faced with a threat which manifests as our fight or flight freeze response. As you may know, well-described physiologic changes in pulse, blood pressure, etc. occur. Anxiety is biologically adaptive and serves to get us out of trouble, but too much apprehension can be paralyzing. Anxiety is an expected and yet adaptive response to the COVID-19 pandemic. However, based on the Yerkes-Dodson law model, we know that high levels of anxiety impair performance. There's a tipping point past the peak of optimal performance where anxiety interferes with our ability to function. We want to be able to be in the adaptive zone, where some level of anxiety is associated with optimal performance. Cognitive behavioral strategies address the interconnection between our thoughts, behaviors, and emotions and physiology as we confront a stressful situation. What skills can you draw on to manage this challenge? 3 skill sets can be helpful, and I want to review those with you today. The first is cooling the brain, the idea that activating our thinking brain and blunting our flight response is helpful. The second one is meeting those basic needs that are more likely to be neglected when we are facing a stressful situation in our lives. And the third one is the skill that relates to the concept of connectivity and importance of staying connected at a time that we are charged to practice physical distancing. So let's address the first tool, and that is, how do we cool the brain? One way is through mindfulness. Mindfulness relates to the concept of living in the here and now, being intentional about it, being in the present moment. However, social and news media are bombarding us with COVID-19 related information and may become a barrier to practicing mindfulness. By practicing mindfulness, we activate the prefrontal cortex of our brain, the part that allows us to focus. So choose not to multitask. Try to focus on one activity at a time. Take breaks from running around multitasking, even if it is to focus on simple activities such as brushing your teeth, cooking, or spending some time meditating. When you are doing those single focus activities, try to, again, keep your mind centered on the moment and living that experience without trying to multitask even in your brain. There are a number of free apps that have tools that help you with exercise and mindfulness. One such app is Headspace, which is currently complimentary to physicians with their MPI number. Another way that we can cool the brain is to consider your relationship with the media. Change your relationship with the media, control it. We need at this time to have accurate and timely information. However, I would suggest that you should limit your interactions with the media to having exchanges and interconnections with reliable sources and exercising control in accessing those sites once or twice a day. The third way that we can cool the brain is to adjust to a new norm. The COVID-19 pandemic has brought out great challenges and a change to all of us. Many of us have been or will be asked to work from home. We've had to cancel scheduled surgeries and learn new ways to provide care through virtual platforms. Furthermore, many of us may be asked to provide clinical care in areas outside of gynecologic oncology. Additionally, those of you with children at home are now having to face the challenges of schooling them at home, and childcare and helping children with remote learning adds additional stressors. The initial transition can feel chaotic. One suggestion is to schedule a new norm at the level of your household and create actual schedules that formally address the needs of all the household members and actually integrate those needs into a formal scheduled system. What I'm suggesting is that you have a family schedule instead of your own individual schedule. We'll now talk a little bit about how you meet those basic needs that now are more at risk of being unmet. Data suggests that approximately 62% of us will change the way that we eat and our eating habits when we're stressed. Access to an exercise program outside the home as we knew it is no longer an option as facilities have closed during the pandemic and we shelter in place. Look for virtual exercise programs. Practice sleep hygiene. Again, data show that chronic sleep deprivation activates our limbic system and may actually have a negative impact on the immune system. Some tools to help you with sleep hygiene include basic concepts such as reducing screen time, changing your relationship with the media, as we talked about earlier, eating a small snack before you go to bed, participating in calming activity if you can't readily fall asleep, and maintaining a regular sleep schedule. And then the final strategy that I wanted to address is how we stay connected. Social support is one of the strongest buffers against stress-related situations. Today, as we face this pandemic, most of us have lost a significant amount of physical connectivity with patients, with colleagues, family, and friends. We need to identify creative opportunities to connect. Many of us have seen Italians singing or having dinner with neighbors by sitting on their balconies. Look for ways to stay connected with family, with friends, and colleagues online or using other virtual platforms. At MGH, we have created a Zoom-based weekly program with one of our lifestyle medicine specialists with weekly sessions where our physicians can participate in learning and practicing mindfulness tools, exercise routines, and sharing their experiences over the last few weeks over virtual lunch sessions. I hope that these techniques will be helpful as you try to manage the uncertainty and the fast-changing nature of this COVID-19 pandemic. Stay safe, stay healthy, and stay connected. And thank you for your time, allowing me to give you some and sharing with you some of these tools that may help mitigate our anxiety over the next several weeks. Thank you.